I have a very special guest for you today, Dr. David Allen, author of a book to be released in November 2018 entitled Coping with Critical, Demanding, Dysfunctional Parents. Dr. Allen is Professor Emeritus, as well as former training director of psychiatric residency at the University of Tennessee Health Science Center in Memphis. He was also in private practice in psychiatry for 13 years in Southern California. Dr. Allen writes for Psychology Today and also has his own blog. He has also written numerous other books on personality disorders and dysfunctional families, as well as books for psychotherapists. I will put a link to his Amazon page as well as his blogs below this video. Welcome, Dr. David Allen. I'm so happy to have you here to talk to us. I'm so excited to learn about some of the concepts you practice and teach. I've definitely found them to be thought-provoking, and it's just great to find a mental health professional who's not only looking at the theory, but looking past it as at what else might be going on. That doesn't often happen. So thank you so much for being here.
Thanks for inviting me, and I appreciate your kind words.
So anyway, let's get started with the first question, because I know we've got a lot to cover here. And I think Dr. David Allen he's dealt a lot with borderline personality disorder for over many, many years. And just talking to him the other day, he has some fascinating stories regarding these people suffering with borderline personality disorder. And I think first things first, it might be an idea just to give our viewers some idea of what the symptoms of borderline personality disorder are, and then what your experiences have been. And I know that a lot of other therapists find borderline personality very difficult to treat, but you seem to have had more success with people suffering with borderline personality disorder. So if you could maybe discuss, some of the experiences you've had and what you found was going on behind such a personality disorder.
Well, first of all, I'd like to talk, what is a personality disorder? And lately, everything in the Psychiatric Diagnostic Manual of DSM has seemed to be defined as a brain disease. That's nonsense. There are things that are brain diseases, like major psychoses and certain types of depression, depression is a symptom, it's not a diagnosis. But when it comes to personality disorder, they're basically maladaptive personal traits and some symptoms. And the borderline personality disorder in particular is sort of what they call joke about is sort of the disorder without a specialty, because it seems like it affects all aspects of their life. They're very impulsive, they're very self-destructive, they'll cut and burn themselves, they make a lot of suicide gestures, and eventually some of them do actually go on to commit suicide. They have a lot of anger control issues, and they tend to what they call split, where they'll idealize you one minute and then you're a pile of crap the next. And it wasn't even if you started training residency, it was sort of a rumor among analysts, and they call it pseudoneurotic schizophrenia and as-if personalities and a bunch of other strange names. Mm-hmm. So eventually they came up with these criteria, and it's a Chinese menu. There's 9 different criteria, and you have to have at least 5. But you can have any 5, 6, 7, 8, or 9. They can all range on different levels of severity. And you can have comorbid personality disorders. In fact, once you qualify for the diagnosis of one of them, you often diagnose, the average is 1.6 other personality disorders you will also qualify for. And it changes from one minute to the next. That's how I know it's not a brain disease, by the way. Because if you have a brain disease like schizophrenia, if you're having an acute episode, you're that way 24/7, doesn't matter who you're with, who you're talking to. But with borderline personality disorder, and I get in a lot of trouble for saying they can switch it off and on. They can't switch off their feelings, but some of the behaviors they can switch off and on. In fact, they're known on medical wards for what they used to call staff splitting. They'd act one way with the nurses and a completely different way with the doctors. And guess what would happen? The doctors and nurses would start fighting with each other over the patient when the well, all they had to do was compare notes, or why are you, why do you think that? Why do you think that? And they realized this was going on, and now most of them know about that. So if you can change your personality depending on what your social circumstances are, or change your behavior, it can't be a brain disease. Because that doesn't come and go. You can't make diabetes. You can do things to make it better or worse, and over the long term, but over the short term, it doesn't. You can't go to a 12-step program for your diabetes. It just doesn't do anything. So I don't view them as diseases. And I've also often found that these people are not psychotic, they're not stupid, and they're not crazy. So they got to know the effect they're having on people. And like, as you said, therapists, very unpopular with therapists, because they're very difficult to work with. They make you feel helpless or guilty or angry, and they're very good at it. So a lot of people don't want to be bothered with it. And, so you're blaming the victim? Well, in a way, I guess you could say that, but really that's what they do, but they don't really want to have that effect on you, really. But they've learned that. They have these personality traits for a reason. They just didn't develop because, they were just spiteful, or one theory was they were born with too much aggression. That's just nonsense, okay? These things have a purpose. Their behavior has a purpose. And when I first got into psychiatry, I got turned off to psychotherapy for a little while, because the psychoanalysts, if you question their theory, they would tell you, you needed to go into therapy to find out why you were resistant to that. To me, that was
so funny.
I mean, come on, you're assuming your theory is true, number one, and that my questions are motivated by resistance to it instead of just curiosity. And I'd pick up there were other therapy schools, and they'd say we have to throw out everything Freud ever. So I got turned off, but then I got bored with just handing out pills for a while, and I'd had some very interesting experiences with some patients when I tried to kill me, when I tried to discharge her from the hospital. Luckily, she was a small woman, so I'm here to talk about this. Another one I met with a patient and her mother, I don't know, a 19-year-old. No idea why I did that. I had no training in family therapy whatsoever. And they got into an argument, which I later reanalyzed, and she slugged her mom in the face in front of her. But the mom knew she was violent, because I knew she was violent because I've heard the stories before I even met her. And the mother stuck her nose in the patient's face and started berating her. And I was more interested in the mother's behavior than I was interested in the daughter's behavior for slugging her. The only reason that there hadn't been any violence, I found out later, was because whenever it got to that point, there was a younger sister in the house who would divert their attention.
Wow. So
the violent point, she'd start crying and everybody would tend to her. So I just had to figure out, A, why people would act this way, and B, what I could do so they wouldn't make me feel like, I was going to be stalked or they might come after me. I mean, I was very unempathic to that girl that tried to kill me. I should have asked her, why are you afraid to leave? What's waiting you on the other side? I didn't, because nobody ever taught me to ask that question. I think, why would anybody want to be stuck in a mental hospital with a bunch of psychotic people? That didn't make any sense to me. But that was very
you weren't told to ask questions. You were just looking at symptoms.
Right. And I was projecting my own, well, I wouldn't want to be here in that. Why would anybody? This is not a fun place to be. You like talking to people that are being followed by Martians? I mean, it's interesting, I guess, for a short time, but that's about it. So I couldn't understand it. And the cutting and burning, especially when I saw somebody do it in front of me, wow. I mean, why would anybody do that? I mean, it just seems so bizarre, but they're not crazy. They're not stupid, and they're not evil. So I started reading a bunch of different schools of therapy, and there's something like 400 of them. And a friend of mine introduced me to family systems. And the last family systems guy I came across was a fellow named Murray Bowen, who talked about 3 generational patterns of problematic family behavior that's repetitive over and over again. And how you can send your patient back into the hornet's nest, so to speak, to change the rules by which the family operates. Now, what he trained his patients to do was have more in common with another kind of family therapy called paradoxical therapy. But instead of sending them back to be a Bowen therapist who looked at the genogram, the history of the family over at least 3 generations, to try and make a determination of might create these kinds of problems. And then there's an aspect to, there's something called cultural evolution also, which plays a big role in this, and that the culture of a lot of the rules by which family operates come from the culture or subculture that they come from. But over time, there's been a big change in the rules away from sort of a collectivist view where we're not even individuals at all, we're just part of the group, to more of an individualistic stance. And some families can't keep up. So there's something an anthropologist called cultural lag, where people are stuck with the old rules, but they're also seeing the new rules, the freedom to do things that they never had. So it's tempting to want that, but your family would never accept it, so you hide it. But it doesn't go away. So with your own kids, you'll often give them double messages because parents tend to live vicariously through their kids.
It's almost like you're hiding it in plain sight. Everybody sees it, but nobody talks about it.
Yeah, you're pushing them to do something and then criticizing them for it when they do it.
Yeah.
It's a double message.
And they're getting the underlying feeling that you're not happy with them doing it, even though you're telling them to do it.
Yeah, and in fact, you're not happy with them no matter what you do. It doesn't matter, because either way, you're criticized.
So you're saying that sometimes in these types of family, there can be some sort of dysfunction or trauma going back in the generations that then causes some of these dysfunctional behaviors in the family that then spur on mental issues in different members.
Well, and they create certain personality issues. Like if everybody's familiar with the concept of like a stage mother. Well, there's another author that wrote about roles that the kids play in their family. And I borrowed liberally from him. He didn't talk about the borderline, but he called it the savior, where your mother wanted to be a doctor or an actress, but she couldn't because it was considered bad for women. Family was really stuck back with gender role stereotypes. So you push your kids to do it, but then if they are too successful, you get jealous of them or envious of them, and you get depressed. And they notice that, and they
pick up on it.
Yeah, so they'll do things. And this is another part that most people don't really think about, is that we are actually biologically programmed to sort of sacrifice our own personal needs to stabilize our parents.
Wow.
Because it has
that's big
survival value. We can't survive without them when we're babies, and we're very helpless for a long period of time when we come into the world. So we're biologically programmed to respond to their needs, and they're biologically programmed to respond to the needs of their culture. So you look at even things like that are really hard to understand, like parents that send their kids out to be suicide bombers in the Middle East, or honor killings. How can they do that? Do they not love their children? Well, I think they probably do, but the consequences of not following the crowd and the group are so onerous, and they're programmed to respond to their parents. So they'll even do things that they don't feel good about it, even though they'll brag about it. I noticed that sometimes even again, this is speculative because I don't deal with child molesters very often, but sometimes they brag about it, and you think, wait a minute, they got to know what everybody thinks about child molesters. They're making themselves look horrible in front of everybody. Why would they do that? They can't enjoy that. They're not. I don't believe they're masochists. Are they really proud of it down deep? Well, how would we know? We can't read minds, right?
Yeah.
So I look at the consequence of the behavior. So there's the old definition of an insanity. You keep doing the same stupid thing over and over again with the same results, you're insane.
Yes.
Well, so what does it mean if you keep doing the same thing over and over again, you get the same results if you're not insane? What it means is that's the result you're aiming for.
On a subconscious level.
On a subconscious level, it's automatic. People aren't thinking about that. At some level, they haven't in the past thought about it.
But could it be like, it seems like the patterns that you picked up as children, you continue them into your adult life. So could they be, it's just following a pattern?
Yeah, and you have to, because it's so hard to do, you have to pick up allies. So you pick up enablers. So that tends to, so if you have these problems.
Oh, that's so interesting.
You tend to marry somebody who will feed into your problem, but you're also feeding into their problem. It goes like enablers with alcoholics. The codependent needs the alcoholic as much as the alcoholic needs the codependent. codependent, not because they're enjoying themselves, because they're not, but it's familiar and it helps stabilize their respective families. So one thing they did, another thing that I was never taught to do was ask about people's in-laws. And once I started doing that, the most amazing information started coming out. I found that the people would often know more about their in-laws in certain regards than their kids did, than the in-laws' own kids did. And they were all experts on their in-laws. So everybody studying each other's family. Wow. But when you're in this mess, you tend to think it's all the other guy. You don't tend to think of they're also helping you out, you know.
I mean, there's almost a blindness, isn't there? Somehow there's a blindness because people are not, even though they might be seeing it, they're not registering it.
It's called Willful Blindness. There's a book by that name by Margaret Heffernan, which I recommend strongly. She talks about how it operates in the business world.
I'm definitely going to read that.
It's a very strong property of what we call groupthink, or thinking along with the group, not for yourself. There's one group of therapists that talked about self-actualization. That's separating your own, following your own muse, no matter what kind of reaction you're getting from your family. And that's a relatively new concept in history. People weren't talking about self-actualization until really it exploded kind of in the, it's been building up. And it goes back and forth, but it really didn't become a 60s until the women's movement, the sexual liberation movement. All that. Before that, everybody just kind of followed the rules unquestionably. And if you didn't, you'll get burned as a witch or something. I mean, there were definitely severe negative consequences.
So now suddenly we're having all these changes, I'm sure also with how society is, technology and everything is changing. And this is having a huge impact on the family as well, and their traditions and how things were done as well, I guess.
Yeah, the example I always give it, if you lived on a farm in the 1800s, the more children you had, the richer you were. Now it's exactly the opposite.
Yes, the more kids you have, the poorer you are.
But some people haven't caught up. They're still stuck back in the old rules. And why do they get stuck? Usually because of some traumatic events that happened to individuals that interacted with their own individual proclivities. They created this conflict, a huge conflict, which is then passed down from one generation to another. So the question of blame, well, whose fault is this? Well, I mean, traditional therapists, if they don't blame it on your brain, are notorious for blaming it on your parents. But then the question becomes, well, why are they acting that way? It just kicks the question back.
It does.
So you find out, well, it's because of the way they were raised and their experiences with that. Why would a mother notice that her husband was molesting their daughter and do nothing about it? Because that was happening in her family, and it was her job to keep it quiet.
Yeah.
That doesn't excuse it, by the way. It's just a way of understanding it. But if you want to blame somebody, I always joke, well, why don't we just blame Adam and Eve and get the whole thing over with? Because this thing has been passed down and developed over generations, particularly over the last 3, but really it starts even further back than that, depending on the experiences that you go. Immigration, for instance, creates all kinds of conflicts because you're stuck in 2 cultures. The parents want you to kind of, you're often sent out to the new culture to sort of help the parents adjust. But they want you to stick to the old culture. Like there was a resident where I used to be the director in the internal medicine. I didn't know her, but she came from India and had been seemingly traditional, but she came here and was here for a long time. She fell in love with an American doctor, but her parents had already made arrangements for an arranged marriage with her. She ended up committing suicide.
Oh my gosh.
That bad.
Oh, that's awful. That's really terrible. Wow.
So because she was in 2 worlds and there was no way to win, you know.
Wow.
You know, the parents had agreed for her to come to this country.
Yes.
To be exposed to all that individualism. Because she
wasn't part of either country because she wasn't living there and she wasn't allowed to become like the country she was living in. Right.
Yeah. So that's an extreme. Not really that extreme an example, but that's a dramatic example of what I'm talking about. Illustrates the point. So yeah, if I'm not excusing a child abuser, and I definitely do not, again, I talked about this before we came on, I do not send people back to continue to be abused, okay? That is, if your only choices are cutting your family off or continuing to be abused, if those are your only two choices, by all means, cutting them off is the better choice. But having said that, you carry them around with you in your head, and it doesn't take much contact for them to reinforce these patterns, and it affects your behavior and your happiness, and you can pass it down to your children if you don't get it to stop. So, and if it were easy to get it to stop, people like me would be kind of superfluous, because really smart people can't figure it out. In fact, most therapists don't know how a lot of the tricks of the trade.
I mean, being aware, does that not give you a benefit? And also, if you realize that there are these patterns out there, you can either ignore them, or you can, go deeper into it and try and change them. Does that change the guilt or some people, they will see all the answers and they still won't take it up.
Certain behaviors of the parent reinforce or feed into your problems, okay? And I always found that the parents were much more powerful at getting their kids, for good or evil, than a therapist like me could ever be. Okay? You teach somebody assertiveness training and they'd be all ready to go, and then they'd come back the next week with their tail between their legs. They couldn't do it. Then I realized that you can't do it once, and you have to tailor it to the sensitivities. And families are very defensive. And talk about like denial. Well, I never did anything to you. Well, that's actually 4 levels of denial. First is it didn't happen. The second is I didn't really mean it. The third is too sensitive. And fourth is, why are you bringing up? I mean, it just goes one after the other. And you can't just address one, because they have a backup strategy to get you to shut up. And if they're distancing, if they push you away, in a way, again, this is counterintuitive, but if you cut them out, they sort of set that up. They're the one, you're doing it you're not really doing it under your will, you're actually cooperating with the system, because they feel like you're better off without them sometimes, because they really do, although they won't admit it, feel bad about the way they treated you. Which also brings up why you don't have to pretend it's okay when it isn't, because they know it's not okay. And if you say, yeah, it was all right that you did that, they'll know you're lying, and that's not really empathy. It's not really very much empathy. Empathy is the key to getting them, trying to put yourself in their shoes and not fall into these traps is the key to getting past their very formidable defenses.
Yes.
Again, the strategies are very different, and they're multiple. You have to have strategies, and then what are they going to do? And if they do that, then what are you going to do? And sometimes if they start on this, you say, when you're ready to stop doing that, give me a call, I'm going to hang up, and then you hang up. But you have to say that bit about when you're ready to stop doing that first.
So it's about putting firm boundaries in place.
Well, that's one aspect of it. The other is trying to understand where they come from so they don't feel attacked, even though they deserve to be attacked. Some of them deserve to be.
You've got to be very strong to do that.
Well, if I didn't think my patients were strong enough to do it, I wouldn't ask them to do it. But it's very intimidating. The weakest part of the treatment I do is getting people to do this even after we come up with a strategy. Because people are scared to death. They really are afraid to do this, even though we've anticipated and you can usually anticipate what, not always, but there's also an escape strategy in case what we predict doesn't happen. But you live with these people all your lives. You kind of know what they're going to do.
And in these dysfunctional families, it's you have certain things you're not allowed to talk about. And I guess what you're telling them to do, you're telling them to go into a place that is usually a no-go area in those families.
They have to break the very first rule of dysfunctional families, which is we don't talk about this. That's like the first rule. We don't talk about it. If we do talk about it, we can talk about it. We can't do it constructively. Problem solving.
Yeah.
In a double message, infuriating, demanding, controlling, annoying way. We can't just do it in a way that leads to a solution. And blaming, unfortunately, interferes with becoming a problem-solving approach, because that just makes people more defensive. It causes a fight or flight or freeze reaction, none of which are helpful in getting them to open up and talk about why they're doing what they're doing and how you guys can avoid this in the future. And again, another point I have to emphasize is that it's not the patient's responsibility to, quote, fix the parents. They can't do that.
Mm-mm.
Okay, but they do have the power to change the relationship. Just theirs, not the parent's relationship with anybody else. Although talking about family dynamics, anything's going to help the parent, that's it. Another thing we have to watch out for is parents who become self-destructive. What if your mother commits suicide when you do this?
Yeah.
How is that going to make you feel? Not good, probably. Even if you think you hate her, you really don't, but you think you do. With good reason. With good reason. You should hate her in a sense, but you really don't. You kind of wish if she wasn't like that. You say, well, I don't want a relationship with my mother. Well, I go, of course you don't. Not the way she's treating you now. But if she stopped that, I bet you would. But maybe you wouldn't. I mean, that's negotiable later on, right?
Yes.
As long as she's treating you, there's no point in having a relationship.
Yeah.
Because it's not going to go anywhere.
I mean, this is all about, I think you need to look at it from a perspective as to what's going to make you feel better in the end.
Yeah.
I mean, you can't change other people, but if you have a better relationship with them to some extent, that is going to help you to feel better.
It really helps the parent feel better too, though. It's a win-win situation. So sometimes I like in the strategies involved, so like a chess match when they do this, you have to think 3 moves ahead, by the way, because you can tell what's going to happen, and you're not always successful at doing that. But then you have an escape strategy, write down the conversation, bring it to me, we figure out what went wrong. Okay, but it's a chess match, but it's one where both people win rather than a one winner and one loser. Because secretly, deep down, and people think I'm absolutely insane when I say this, your parent really does wish they had a different kind of relationship.
I mean, I've been reading Lundy Bancroft's book. I don't know if you know, he usually helps abusers. He has a program for domestic violence abusers. So would somebody that is an actual domestic violence abuser, would this apply to them?
Probably not. Okay, because a spouse, while an important person in your life, is not an attachment figure and doesn't have the same influence over you that they do. You can leave the spouse and fine, but
if you had a parent that was like that,
that's because you have to look at your role in that. Because it's familiar to you, you're attracted to somebody that has the same kind of family dynamics that you do, and both of you help each other to stabilize your respective parents. So if you suddenly say, I don't need you, and you got to so I have to worry about, well, how's the spouse going to react too? Because even though they may complain bitterly about something that goes on between the two of them, if it stops, one of them thinks the other will leave, or one of them actually does leave. And certainly people feel betrayed, even though they say they like the new way better. So when I first heard that, because I used to do some couples therapy, and I talked to the individuals apart from each other, and he says, yeah, if he ever solves this problem, he's going to leave. And I go, what? You're complaining about us all? What? And I talked to other marital therapists, and I go, yeah, we hear that a lot. Oh, really? How come it's not in any of the books, right?
Wow, that's weird.
I had one patient that say, I can't leave my husband now because he's depressed, but if he ever feels better, I'm out of here. Well, that's a good to get better, right? I mean,
yeah.
So the family systems people think that it's just they're caught in a vicious circle. So they give this example of the nagging wife and the alcoholic husband. The more she nags, the more he drinks. She nags. And it's just a vicious circle. But that model presumes that these people are so stupid they can't see what's happening. The nagger knows that the more she nags, the more the drinker's going to drink. And the drinker knows that the more he drinks, the more the nagger naggers. So if that's true and they keep doing it, how do we explain for that? Either they could be crazy, but they're not psychotic. They could be really, really stupid, but they'd have to be like a kumquat. They'd have to not literally see what's being hit over the head with the board 6 times and not realizing a board was hitting them over the head.
Mm-hmm.
I can't believe they're that stupid, frankly. Or they could just be evil or something. So what if you don't make any of those assumptions? How can I? And I wrestled with this for so long before I learned about something called dialectics, which I won't get into, which is that each person thinks it's the other guy that needs the relationship to continue in its current form.
So
the only way you can explain it, and they're maintaining the relationship by each one's giving the other what they think the other wants, but they can't talk about what they really want either because they're operating by the same rules that their parents are.
And everybody's keeping quiet, so they're not talking and they're not finding out what the other person really wants.
All they know is that the other person seems more relaxed what the nagger notices that when I nag, even if my husband complains like crazy, he actually seems calmer.
That's weird. So I just want to ask if, I don't know if you could maybe give some examples of where you've had a patient, maybe one of your borderline patients, where you realized that the family was acting out, well, the borderline was acting out because of the family dynamics, and what kind of, sort of things that you did in order to get that, what you maybe got the borderline person to do in order to, get the family to change.
All right, well, first I have to get them to quit doing it with me, because they'll see if the therapist is going to be an enabler. Also, that's why they're so hard. But there's counter moves.
Yes, that's like
the beginning therapists, and they worked almost every time. And all
wow.
of the therapists that deal with it, they all start using these same techniques or variants of them, and then they diverge.
That's projective identification.
Identification, yeah, they're trying to see if you're going to react just like their parent. And they're very, I found, how did I learn about this, by the way? Well, the first way I learned about it is people with the disorder are always accused of distorting everything.
Mm-hmm.
I had patients that were so angry with former therapists for accusing them of distorting everything that they started recording their parents' phone with them. These are adults with their parents when the parents didn't know they were being recorded, and they brought me the tapes. And I started listening to this stuff. And the first thing I noticed, gee, they're good at getting me to sound just like their parents. They do that. And you have to listen for a long time. You can't just listen to part of it.
I mean, if you just stopped there, you would think that this patient, you would put all the blame on the patient, because you'd think that the patient was making you and the parent act like that. It was their fault.
So I had this one patient who was the worst cutter I ever had. She would cut all across her arms and she was scarred all over the place. And she led on, and she would have been accused of distorting, that her parents spent several hours a day lecturing her when she was a kid. And it was sort of still going on. So she brought me a conversation between her and her mother. And the mother was saying really worried. She seemed really worried and concerned about it. But if you didn't know it, that they, first of all, the tape was over an hour. And second of all, they'd have the exact same conversation multiple times.
In the same day?
Sometimes in the same day, and sometimes over extended period. Some parents would call they would let them get away with murder in one context, but they'd be checking up on them every 5 seconds on the phone. So the patient would come in and go, my dad's controlling. And then you meet the dad. Because then I started inviting the parents in for conjoined sessions.
Mm-hmm.
And the dad seems like he's letting her get away with murder. He keeps giving her money and blah, blah. He doesn't seem very controlling at all. Okay, but what neither of them tells you is, yeah, he does that, but whenever she leaves, she calls him every 10 minutes. He calls her every 10 or 15 minutes to check up on her. All right. So I had to come up with, like I said, I had this model that this other therapist talked of roles that family play. And there's a term that's applied to borderlines called spoiled. People with borderline, actually people with borderline personality disorder, because they aren't the disorder. It's an adjective. Everything the parent does for them, they ruin. They buy them expensive clothes, they'll mess it up and lose it. And they'll criticize the parent, tell them what awful parents they are. And they'll do all these horrible things, and you feel like, God, poor parents. And there's some of my cohorts are really taken in by this, because once they reach a certain age, it becomes their part of the problem too. Okay, it's not like they're totally not involved, but it's very understandable why they do this, because they don't know how to respond to another. So I call the role of this, and why would anybody do that with their parents? So again, reading all the different theories about borderlines and listening to these tapes, I came up with a historical model that is, the parents have developed a conflict over the role of being parents. They think it's the end all and be all of human existence, but they hate it secretly. Especially, a lot of them are from gender issues, because a lot of women were they're like Catholics and they're told you have to have 20 kids, or they came from the farm and you had to supply the help. That was the rule, that you had a lot of kids. But then you see your friends in the 60s and 70s cavorting and say, oh, we can be anything, we can be astronauts. And that sounds good, but you've got all these kids at home. So the kid ends up getting this message, I hate you, I love you. I need you, rather. I hate you, but I need you. Because the parent needs to stay in the parent role, but they hate it at the same time.
Yeah.
So the solution is actually brilliant. How do you, when that's kind of a mixed message, how do you stabilize a parent who, if you do one thing, they feel too guilty, and If you do it the opposite, they get angry with you. How do you stabilize? It's a brilliant solution. When they get angry, you make them feel guilty. And when they get guilty, if they go too far the other direction, then you make them angry. So if you're a spoiler, you never grow up, right? You ruin all your things, and you're always in and out of psych hospitals.
And you're not responsible.
You're not responsible, so you never leave, but you're ticking them off all the time, thereby giving them justification to blame it on you rather than on them, so they don't feel so guilty. But if they get too angry, that destabilizes them. So then you got to make them feel guilty and tell them what awful parents they were.
Yeah. And remind them of all the things they did to you.
Yeah. And sometimes they do that. People have actually looked at the patterns. An interpersonal therapist called Lorna Smith Benjamin is the closest to what I've discovered. And one of her 4 criteria for the families of people with borderline personality disorder is that there's all this chaos going on, and somehow the child is expected to stabilize everything, fix it.
So
I actually looked at the families. Most people don't.
So the borderline is actually acting like a regulator.
A regulator.
For the parents' emotions.
Yeah. All the dysfunctional roles do that to some degree. The borderline
that is absolutely fascinating.
Extreme, because you have to really resort to some really, so they'll do the same thing with therapists. They don't do it with people they meet at rock concerts. They don't act that way. They do it with 3 people primarily: lovers, parents, and therapists.
Wow.
They don't do that behavior around other people. So other people, God, it's like when you hear about somebody did a horrible crime or something, and all the neighbors are saying, but he was such a nice guy. Oh, like everything that goes on inside people's heads and behind closed doors is obvious, right? I mean, that's where our field has gotten. It must be obvious, you know.
Yeah, I mean, I've noticed that actually with another sort of concept also about you find that these people that are abusive in some way, even the mental health professionals, they think if somebody, they can't believe a person is abusive because they have other qualities that are good. But they don't realize that no one is all bad.
Well, that's it.
I think you might have said that. I can't remember, but I find that fascinating.
One of the prime things in so-called cognitive therapy, where they look at the logic of this stuff and try to dispute it, which to me in this kind of a situation doesn't work, because the logic is not what they think it is behind the behavior. But one of Albert Ellis's guy that sort of invented cognitive therapy before a guy named Aaron Beck came along, said one of the things is people are not all good or all bad. There's no such thing as an all bad person. You know, a Holocaust victim wants to say Hitler was all bad, fine, you know, but he made the trains run on time. You know, we all, it's not excusing the bad behavior to say, but everybody has their flaws and faults.
Yeah.
Huge, but that doesn't mean everything they do is bad. But yet we accuse our patients of doing the splitting thing where everybody's either a god or a pile of crap. But we're doing it, you know.
Yeah.
I had, you know, I think I had one patient, when she turned a certain age on her birthday, her dad raped her and then bought her a pony.
Wow.
How do we figure that? We can't figure that out as mental health professionals, but we're expecting an 11-year-old, 12-year-old girl to.
That, if anything, is going to push you off the rails. That is, especially for a child.
I understand it, though. You can't ask. You can't ask because I can't predict exactly how they're not going to answer the question. It could be anything from just blowing you off to beating the crap out of you. But I can readily predict that they won't answer it. If you point out.
Yep.
They won't answer. So how do you get them to answer? Well, that's not easy. There's different ways to kind of get in through the back door to get them on board. And it's not easy, and it's very complicated, and it takes a while, and it takes a lot of persistence and bravery too, because it's very scary to do this, even with the best laid plans. And there's no guarantee that even the best laid plans will work. We may have to change them as we go along. Sometimes I can't figure out a good way for a while, and sometimes the patients figure it out before I do, which is really interesting. I had one guy that his mother's trick, whenever he confronted her with the fact that she was always asking him to come over and do everything around the house, but then told him what a horrible job he was doing. Whenever he tried to talk to her about it, she'd become sexually seductive. I mean, she wouldn't actually abuse it. And I said, well, gee, how are we going to? And he came up with the answer was just telling her to knock it off, and that worked. Okay. He came up with the answer before.
I mean, the patterns are so weird, aren't they? How it's just like, it makes no sense.
Every time I think I've seen it all, boy, am I in for a surprise.
Wow.
I had one lady who was not sexually abused for her father, but her father would admit to doing it to the mother because the mother seemed to want to believe it. And he would do it in front of her. That's crazy making. Wait a minute. He didn't do anything. Why is he telling her? Why is he complaining or describing this awful behavior he's doing to my mom?
Wow.
Do it. I mean, that's why
it's crazy making.
It's, you just never know.
It's like a double bind.
That's exactly what it is. Damned if you do, damned if you don't. But see, there's four elements of a double bind. Damned if you do, damned if you don't. You can't leave. Although you can now, but not really completely. But the fourth one is you can't comment on the bind.
Yeah. Was it Gregory Bateson who thought at one stage that schizophrenia was caused from that?
And that family therapist got a bad name because they applied these ideas to psychotic people. Again, I don't know how you feel about it, but I think that's a real brain disease. These kinds of things can make it worse, but I don't think they're the cause. We don't know the cause. But there are brain diseases, like Alzheimer's disease.
I wanted to ask you a question again, and I know that the viewers, this is going to be something that is going to be very difficult for them to understand, is that I know that before you've said that these very dysfunctional parents, they will still love the child, that sometimes they've ousted that child, sometimes they've done really awful things to that child, and yet you believe that they do still have a love for that child.
Yeah, going back to Lorna Benjamin, she has one of my favorite phrases. She calls it hatefulness is a gift of love, or psychopathology is a gift of love. And hatefulness, I changed it to hatefulness, can also be a good. If they think you're really better off without them, they'll act like they want you to leave, and they'll do that by being as nasty as they possibly can every time you try to connect with them. Sometimes with the borderline families, though, there's a yo-yo. They'll push them away, and then they'll suck them back in, and then they'll push them away, and then they'll suck them back in.
Yes.
That's almost Catherine and Mom. That's almost a diagnostic of a family with issues of borderline. You can't live with them, can't live without them. So
yes.
You get so they.
Well, is it because of like the honeymoon period, like even similar to domestic violence, where they get some sort of high?
It's done on purpose that way. I mean, they suck you back in because the parents are ambivalent about having you around. They really want you around and want to have a good relationship, but it brings up their conflicts, and they think you're better off without them. So because they're ambivalent, if you go one way, you come across the other side of the ambivalence. You go that way, you come across the first side. So you can't win.
Wow, so that's interesting. So on some level, they acknowledge that they're bad for you, and maybe that you're bad for them, and so. But instead of telling you the truth, they would act in a very vicious manner and oust you or do something like that to get you away from them.
Absolutely, exactly that. And again, you would have if you're in that situation, you have no way of knowing that's why they were doing it. Because you can't read minds.
Wow, that's crazy. But I mean, I can see that there's, because I've seen these patterns. So what you're saying is kind of building on it, what I've already seen. It's just fascinating.
Well, I am coming out with a self-help book. It's not for people with the severe personality disorders.
Yes, tell us a bit about the book that you've got coming out.
People would need a therapist. So I'm mostly dealing with, the title is Coping with Critical, Demanding, and Dysfunctional Parents, but it also includes things like invalidation, where they think they know more about you than you do, and everything you do is nonsense, and distancing, where they're hostile and pushing you away. And it starts talking about some ideas from biology that explain why we're willing to sacrifice ourselves in certain situations. We're not as selfish as we like to think in America. We can be very selfish, by the way, but it's contextual. It depends on what context we're in. So it's going to teach you how to research the family history, come up with a hypothesis, gives a lot of historical patterns that account for a lot of these different roles that people play. And then there's a chapter on how you end up feeding into it, because you have to survive, basically. But you have to realize, and you have to admit that you're feeding into it, or otherwise, if you're in denial also, that interferes with the process of discussing the issue. So you might have to say, well, you're right, I did do that, but that's because I always thought you wanted me to, and here's why. You have to explain why you did those things that they're accusing instead of getting defensive, which is the it. So what I want is sort of the counter-instinctual response, because when somebody blames you for something, you want to defend yourself. Well, don't defend yourself, admit to it, but then explain why your behavior is based on something that maybe you're misinterpreting about them, and give them the opportunity to clear that up for you.
Mm-hmm. If they will.
Well, they may right away, or it may take a whole pattern of strategies and counter strategies. I mean, it varies all over the place. But I go into the beginning strategies, how to get started, and how to pick one, because you can't tell just from the pathology which strategy is going to work with a given family or a given family member. It's going to be different. But I give 5 beginning strategies to get started after you've done. You have to do all the research, and you also have to understand all the ways they get you to shut up before you even get started. And if you're married, you have to deal with your spouse first. And if you have siblings, they'll get in the way also.
Oh, yeah.
You have to learn how to get them out of the way before you even begin to tackle your parents.
Because they're all a big structure, these dysfunctional families. So as soon as something starts to get toppled, the other siblings will come in and try and put it back to what it was.
Everybody, even though everybody kind of wants it to change, everybody's scared to death because they think that parents are going to go crazy, and everybody's protecting their parents.
Wow.
It's far more common for a victim of sexual abuse to hide it from everybody than to lie about it and exaggerate it. It's not even close.
Wow, that's
It's hard
interesting.
to get them to tell you about it. They'll say they don't remember, but that's not true.
So
Anything that happened between the ages of 5 and 9, nothing. So later, in a different context, I'll ask them about their 5th grade experience, and they'll be able to tell me. They go, well, I guess you do remember some things that happened between. I mean, I won't say it that way, but that told me that, they just don't want to think about it. I don't know, as a reply, often means I don't want to think about it. And I say, well, I know you don't know, that's why you're here, but give me a guess. What's your best guess?
Yes, and sometimes it is it's just like they're on another channel. They're not.
Well, they don't want to think about it because that was the rule. Why don't people tell about sexual abuse? Why don't they tell their mothers? Because the rule is it never happened. And sometimes they get told that by the abusers, or they'll threaten other family members if they tell. But usually it's because it's just implicit. They know that they're not going to believe. And in some families, if they do go and tell the mother will either not believe it and believe the husband, or they'll blame the kid. You seduced him. How horrible, right? I mean, I'm not excusing that. Please, nobody get the idea that I'm saying that you should forgive them right off the bat for that when they won't even admit that that's what they did.
Yeah.
That's ridiculous. I don't think but that denial has an effect on you.
Yeah.
And sometimes you start thinking, well, maybe it's me. Maybe I didn't remember it.
And you're picking up the rules of the family.
Yeah, sometimes it's overt. It never happened. Somebody was writing a diary and the mom tore the pages, just those pages out that described it.
Wow.
Just those.
Crazy. That's crazy. It's still in her head though. Might not be on the paper.
It might not be in the paper, but everybody, it's like there was an old substance abuse rehab commercial where there was an elephant walking around the house and everybody was ignoring it. That's the elephant, they're literally an elephant in the room, right?
Wow. That's
and
amazing.
That's what these families are like. They all know that, and it's hanging over the relationship, and everybody's on edge constantly because you're always walking on eggshells, even though you're well rehearsed.
Yeah.
You're compulsive about behaving the way that they seem to need you to behave, and you don't have to think about it. It becomes so automatic that you're just responding to the social cues.
Yeah.
In general, 80% of what we do in life is not thought about, or no decisions are made. We're just responding to cues in the environment.
And the patterns that have been built up in our.
Yeah, because if you had to decide on every little thing you did, you'd never get anything done.
Yeah. So there's a reason for it.
Red shirt or a blue shirt, you don't spend a lot of time thinking about that. You just make a quick decision based on, just jumps into your head. And they'll do studies that show it jumps into your head before you're even aware of it. But that's because they're not making a decision. They're just reacting automatically. And that's what everybody's doing. So they're really good actors. I mean, you have to be a pretty good actor to pull this off, but they do it. But there's always little signs, if you watch really closely and you know what to look for, that contradict what you think. But most of the time they happen so fast, and when you least expect them, then you miss them. I have to do that with patients. I have to write fairly extensive notes after a therapy session because they may contradict themselves weeks later. And if you just bring it up then, they would deny that they ever contradicted themselves. An example I gave was a woman that told me in the very first session that her father was an alcoholic. And then when I brought it up a few sessions later, she got really mad at me. I never told her he was an alcoholic. It's in my notes. Well, it turns out he wasn't an alcoholic. He was a junkie. So it was both true and not true.
Wow.
But if I hadn't had that in my notes, I wouldn't have a leg to stand on. Well, I thought my memory isn't that reliable for details. For the big picture, it's fairly real. That's another myth. That memory is so unreliable that we can't count on this. Well, you may not remember what color shirt your dad was wearing or exactly how old you were, but it's very unlikely to get getting raped mixed up with taking a nice trip to Disneyland. You don't.
Yeah, big things.
The whole gestalt, the details are blurry, but something like that you can't stop thinking about.
Or your feelings at that time. You might not know what they said anymore, but what they said made you feel a certain way, and you remember that feeling.
They did a follow-up study of kids that were sexually abused as children, were taken to the hospital, sperm was found, there was no doubt, and they interviewed them 20 years later, and a lot of them said they didn't even remember going to the hospital.
Wow.
Are they saying the truth? I think not. They don't want to remember going to the hospital.
Yeah.
I would. And you can get flashbacks of it. That's what PTSD is.
Yeah.
Borderline personality disorder is often called in some circles complex post-traumatic stress disorder.
Yes.
So at some level, you know what happened. And so does your parent. So all the denial in the world is not going to convince me that they don't know that they raped you. I mean, that's ridiculous, right?
Yeah.
They're lying. You could say they're in denial. Well, that's an interesting term. The term denial has come to mean you're admitting to something, not really denying it. So when an alcoholic says, I can stop drinking anytime I want, they're in denial. Well, no, I'd say you're telling the truth. You just don't want to stop.
Yes.
You admitted it, You're not in denial. You're lying to yourself, or you're trying to.
And to everyone else too.
And everybody else too, yeah. So you got to get past all that stuff.
But then they start to believe their own lies.
Yeah. At some level, they act like they believe it, but they know at some level that
that's not true.
Not true, yeah.
I wanted to ask you about, so obviously either the scapegoat or the borderline personality person, in their family, they are playing some role. So what happens when either the scapegoat quits or the person with borderline personality stops acting out? What happens to the family in those situations, this dysfunctional family?
If it's done well, the person and the parent just agree among themselves to react differently, and nothing. The parent may start acting better because they understand why things are going on. If you discuss the genogram or family history, if you just got out of the role, what happens is if you have a sibling who was previously unaffected, they may jump into your role and you may stick them with it. So it looks like they want you to stay in the role because they don't want to have to play it themselves. And that's somewhat true, but the real reason they want you to play the role is because dad picked you. They're doing it because dad picked you, not because.
So another family member will step into that role.
We'll step into the role. I call that sibling substitution.
That's so interesting.
I had this one lady that came from a family with a genetic illness, and she was taking care of her parents, but the mother also had a conflict. She wanted to go to college, but never could. So this girl seemed to be okay, so they sent her off. And her sister, because she had been looking after them, and her sister, who had been married and hadn't been drinking, suddenly got a divorce and became an alcoholic and moved back in with the parents.
Wow.
Took over for where my patient had left. And my patient sort of felt bad about that. Like, I just thought, well, that's not a good outcome either. I don't want to stick somebody else with the problem.
Yeah.
That's where you have to deal with the siblings too. It's like I said, this.
And this family didn't need to be like that. If they just confronted their problems, the issues the parents were having, that they needed one of the children to be there.
Or they could have maybe there were no other options, or maybe they felt bad about sticking so they needed an excuse. I mean, there's all kinds of reasons. There's so many combinations of these things. They all follow a general pattern, but the specifics are all over the map. There's all kinds of different reasons why they can't pick some solutions over others, you know.
But it's definitely not good to carry on in those patterns. I mean, a lot of the people that are watching this video are going to be the ones that are suffering immensely because of these dysfunctional families. And it's definitely not the right decision to continue on with the family's patterns.
Well, that's the worst of the three possible decisions. The second is to get out. And the third is to find therapists that know about family dynamics that can help coach you. I borrow that from Bowen, on how to approach your parents to get a different response in ways you never would have known or thought about before. And if you have thought about them, you already know they don't work, so those wouldn't be the ones we'd use. What I do is I have the patient play their parents as best they can. Again, they can usually do that, although people with the disorder hate to play their mothers for some reason. But, so they might say, well, she would say. But if they do play it, I try different, and I'll see what they're up against. And when I first started doing this, I was like, oh my goodness, no wonder you do what you do. You know, it's like, wow, would she really say that?
Yeah.
Yeah. And then I'll try to find something that seems to be on the right track, and I'll pursue it to a certain point, and we'll see if we run into a roadblock. If the roadblock is insurmountable, then we'll try a different strategy. Then after we come up with a strategy, then we change places, and I play the parent. I'm from Hollywood, so I got some, but, and I give them the worst case scenarios to prepare them. And usually they fall right back into the old pattern immediately, and I have to stop and go, wait a minute, you just did it again. Remember what we talked about, try this. And
you're used to it now because they've been making you act like the parent anyway in the beginning.
Well, there's a way to get accurate descriptions. The distortions, I have a whole series I have a book for therapists about borderline personality disorder, and it talks about how to get to the truth, because there's linguistics to it. Certain languages indicate that it's ambiguous. It's not clear what they're saying. You think you know what they're saying, but there's another way to interpret it.
So which book is that?
It's called it's a terrible title. I didn't come up with it. It's called Deciphering Motivation in Psychotherapy. It talks about how family members read what other people say and on all the different levels you're reading them on.
And I just want to say that I've just started reading one of your books on unified therapy, which is actually your modality of therapy. And I'm just so amazed that I can actually understand it. You know, yeah, sure, it talks about some complex terms and that, but it's absolutely a fascinating read. And, you know, so even if some of Dr. Allen's books are for psychotherapists, I would recommend that people take a look at them because he does explain a lot of these things. And
I try not to use too much jargon so most people understand it. You know, it helps to have some familiarity with psychology, but it isn't absolutely a prerequisite.
Yes. No, you can still, I mean, you might have to look one or two words up in the dictionary, but and it's not as, you know, some of the psychology books are so boring. You're just like, oh my God, I'd rather pull my nails out one at a time than read. I feel sorry for the psychology students having to read that.
Well, yeah, and you should look at the psychoanalytic literature. I couldn't understand it. They use the horrible jargon. You need to read a book about like some of the famous analysts, because if you read them, they're totally. But that's another subject. Anyway, so I hope that gives sort of an overview of what.
Yeah, sure. I just want to ask you, as to, you know, you said that there's certain forms of therapy that help individuals who are in these situations. I was wondering if you could name some of those therapies.
Okay, they're very hard to find because not very many people are doing them. The field is not moving in. Looking at family systems has become politically incorrect. And some of that was the fault of the family therapist for blaming things like schizophrenia and autism on mothers. That was wrong. But most people don't look at it. And it's still, a lot of them just focus on you and your head. There's something called, which I didn't mention in blogs called Internal Family Systems there, where you're looking at the voices in your head, so to speak, or the thoughts basically in your head.
Yes.
And sort of getting in touch with who you really are that way. I think you have to deal with the external things. That's what I mean. You have to deal with the real people. There's one method that's most common in the U.S. called schema therapy. And then again, they're dealing with your mental models, the rules that you follow, and helping you dispute them. And they're starting to actually coach people to deal with a real person instead of just with their model of the person in their heads. At least that's what the guy who founded it said when I last spoke with him. My model is based on Bowen family systems therapy, and there are some, and they can get kind of weird sometimes too and get into foods and all kinds of strange things too, and they'll see individuals. You don't have to come with the whole family, but they're the ones that looked at genograms and issues of enmeshment and people that are stuck together versus people that have a hostile relationship, or there are some people that have what they call a hostile and enmeshed relationship, where they're constantly together, but they're all constantly driving each other crazy. He didn't really go into the historical backdrop as much, but there's a book about genograms written by a lady called Monica McGoldrick, and Randy Gerson, I think, is a co-author, where they look at histories of famous people. And in some you can see a generation of alcoholics followed by a generation of teetotalers, followed by a generation of alcoholics. It's really interesting, some of the things they see. Again, they don't go into the whole bit about cultural lag and cultural evolution.
Yes, that's a fascinating subject, and I was going to ask you about that as well, but I know that your time is limited, so maybe, I don't know if you'd be prepared some other time, maybe we could talk about that.
Okay, that's getting into really theoretical stuff.
Yes, but it's just fascinating.
I find it interesting. Again, if you want to see the neurobiology, I can recommend books though. Let me finish with the therapy models. Lorna Benjamin has something called interpersonal reconstructive therapy, but I don't think there's a lot of people out there doing it.
Mm-hmm.
Personal therapists who also read her. She started out as something called interpersonal therapy. In England, there's something called cognitive analytic theory, which is very similar to what I do. And that's the most common one in England. And then there's something called personality-centered or unified. Somebody else used the term unified therapy named Jeff Magnabita. And there's some people that try to come up with an integration of all the different schools, and they touch on some of the things that I do. And a guy that's associated with that, his name is Paul Wachtel.
Oh, I appreciate it.
If you're interested in the biology of groups and individuals from the atom all the way down to evolution, there's a very long book, but very easy to read book called Behave by Robert Sapolsky. He's a Stanford biologist, and he disputes a lot of the myths in the field.
Yes.
I would. And he goes over why all the different, and his main theme is that you can't look at a single cause. There's only risk factors. And there's literally thousands of them. They increase the risk of certain behaviors or they decrease the risk of certain behaviors. No one factor determines your behavior. There is all reputable neuroscientists will tell you that there is no gene and no set of genes that causes specific behavior.
Yeah, it's because everyone is an individual, isn't it? Not all their circumstances can be the same.
Right. Yeah, and there's so many different variables. That's part of the mythology. They think they control for the variables, and they really, really don't. There's people who look at your reactions, your reactions to stress without looking at what's stressing you. To me, that makes...
Yeah. I mean, that's the last question I want to ask you, because that is a really important one, is what exactly is going on in the mental health fraternity? I know that when I went to, I experienced a lot of trauma in my actual environment as far as my family of origin and the person that I had married. And when I went through I consulted the mental health professionals, and they didn't know what I was talking about. Could you maybe talk about that as to what your thoughts are on that?
Well, the field again is something called cognitive behavioral therapy is sort of predominant right now. And the behavioral part seems to be dropping out. That's where they look at the environmental influences and in favor of the cognitive. They just look at the way you process information. So they look at how you handle stress and what you tell yourself, and distress tolerance skills and anger management. That's presuming that you've got the problem. So I always joke that, so if you're upset after seeing ISIS behead your entire families, you have to poor distress tolerance skills. I mean, that's it. But it basically comes down to that. They're very good for mild depression and non-dysfunctional family stuff. But when it comes to this stuff, I don't recommend it. I have a post on I have a blog on Psychology Today called The Matter of Personality. And I have one post on how to pick a good psychotherapist. We talk about how to do that. And you can call and ask about therapist orientations before you make an appointment. But the kind I'm talking about, it's not where the field is going right now, unfortunately. Managed care first of all, it's time consuming. It doesn't happen in 10 sessions. You can't do it. It's absolutely no. Everybody who treats personality disorders know you can't treat them in 10 sessions. That's crazy. No. It's ongoing. It's long-term therapy. It's hard. Okay, so you can find out, yes, a lot of people have very insurance limitations there. So it's really high. So again, don't try this on your own if you can't figure out. You can read my self-help book, and I hope you can find something. But if you keep running into brick walls, don't keep running into brick walls. Get help.
Yes. Yes.
Like I said, I couldn't go into all the more severe, they didn't want me to get into a history of physical and sexual abuse, for instance. They didn't want me to deal with people that came from those families because they thought those people really did need therapists or ways to calm themselves down, but not go back to their family and try to confront them. That's, without the help of a therapist, I would not recommend. Who knows what they're doing? Because if you do it badly, that's far worse than not doing it at all.
Yeah, so people that do not have access to somebody who can be helpful in their life, a mental health professional who knows what they're doing, and they're dealing with a lot of trauma related to that family, it is actually better for them to separate themselves from that.
And learn the distress tolerance skills from those therapists so you at least handle it better. But it won't address the underlying problem because the triggers are so big. Okay. But you will tolerate them better. It's sort of like, again, another metaphor I always use. Somebody's going around stabbing you with a penknife. I can give you an opiate. It won't hurt. But shouldn't we stop the guy with the knife?
Yeah. Yeah.
And in fact, there is some movement with the child adverse childhood experiences. Question to ask a child is not what's wrong with you, it's what happened to you.
Yeah, definitely. I mean, that should always be the question, not to say that you're not going to be responsible, because once you know what's wrong and that you have the responsibility to try and change it and do things differently. But I agree with you 100%. It's been absolutely fascinating talking to you. I'd just like, before we go, I'd just like you to tell us a bit about your new book, when it's coming out. I did actually talk about it in the beginning of the video, but if you could just, refresh our memories, because I'm really excited. I'm enjoying the book I'm reading now, and I'm excited for when this new one comes out.
It's not coming out until November 1st, so there's still a wait. It's available for pre-order, but why would anybody do that? I don't know.
So that's on Amazon. I'm going to give your Amazon page below this video.
It's on the author page. Here's I don't know if people can see it. That's what the cover is sort of going to look like.
Oh, great. Yes.
It's called Coping with Critical, Demanding, and Dysfunctional Families. The subtitle is Powerful Strategies to Help Adult Children Maintain Boundaries and Stay Sane.
Well, it sounds like that's going to be the beginning steps for people that are dealing with these dysfunctional families, and it's going to give them a step in the right direction, even if the families are severely dysfunctional. Because you said it's more for sort of the normal type of dysfunctional family. When it gets very severe, that gets a little tricky.
It's very tricky.
So anyway, it's been great talking to you, Dr. Allen, and thank you so much for doing this interview with us. Thank you.
Thanks for inviting me.
Goodbye.